The opiate epidemic in particular has a biological side to it because opiates are so physically addictive. When people start taking them, they develop tolerance and withdrawal that makes them need and want to take more and more. I'm absolutely encouraged by the bipartisan support for relief of the epidemic, because this crosses all demographics and all state lines and all rural urban communities. I think what we can continue to do is to provide treatment and resources for people with addiction. That's going to be the #1 source of a solution to the opiate problem. On the treatment side, absolutely keep parity for mental health treatment, because addiction is a mental health disorder. As long as we keep those treatment resources in place, that will drive the presence of doctors who are willing to treat it and drive the ability of patients to get into treatment when they are ready. The next level of care would be to find ways to encourage people to get into treatment. For all forms of addiction, we need psychosocial treatment. So we need to treat the underlying psychological causes of addiction. People who are depressed, people who are anxious, people with untreated ADHD are all more likely to develop addiction when they experiment with a drug of abuse. So we've got to treat that underlying psychopathology. The other thing that we have to do is treat sociological problems that go along with it. Poverty, disconnection, lack of opportunity, all of these things are underlying any epidemic. Prevention shouldn't take the form of just say no to drugs. Prevention should take the form of, here's a child in crisis who needs help, and how can we help this child escape the abusive or the neglectful or the under-resourced home. And if we can do those things, then we can hope to turn the tide for the next generation. This year we decided to look around and see where we could do the most good. And it turned out that we could do the most good in the emergency department at Duke. So we're working with emergency room doctors to try to get an increase in naloxone prescribing and try to get more partnerships to get people who come in with an opiate overdose connected to treatment resources.